Hi, this is Dr. Eric Westman with Adapt Your Life, and the topic of this video is the keto diet confusion in 2020. First, I'd like to bring attention to the Adapt Keto events coming up in March. On March 7, we'll be in Long Beach, California, March 14, Winchester, Virginia, and March 21, Atlanta, Georgia. Winchester and Atlanta will be repeat events that were done last year. Last year, the Adapt Keto events brought out about 3,000 people on Saturdays to talk about the keto diet. An amazing phenomenon happening. So I hope to see you March 7 in Long Beach, California. So what is the keto diet and why is it so confusing? You know, if you can imagine, this is a fire hose of information called the Internet, the big circle there. You look up the keto diet and what do you see? You might see actually one of three different things, and then you might see a kind of merging of all the three things that really has never been studied before. And so that's a bit of a foray into, trial and error and try for yourself. But the first thing to notice is that there is evidence and research behind the ketogenic diet for epilepsy. This has been known for about 100 years, that some children and adults with epilepsy can be improved or even fixed if they cut the carbohydrates out of the diet. But you have to be very careful with these children and adults who are sensitive to the carbohydrates. Every meal has to be carefully calculated to be sure that the ketone level is fine, and even a bite of a candy bar can cause a seizure in these children with epilepsy. But that's not what I'm talking about as the keto diet for diabetes and obesity. But you may hear that as a source of confusion. I've even seen press releases and dietitians interviewed saying that the keto diet for obesity is like the ketogenic diet for epilepsy. You have to be very careful about every meal. And no, you don't. It's different. Another confusing source of information is the whole paleo primal idea, where you want to eat real foods and as clean as you can, or even some people will say that you always have to have food that's coming from your own garden or the farmer's market, or you make sure there's no antibiotics and no they pay attention to the omega-3s, omega-6s, grass-fed beef, and that's not what I'm talking about for the keto diet for obesity and for diabetes that we're talking here. I'll get to that in just a minute. But these are sources of confusion, and when someone comes to me and they find it too complicated, I find what I do is make it a lot simpler for them. Because what I'm talking about when I teach, also known as LCHF, or low carb high fat, low carb healthy fat, or LCKD, that was our research study name, low carb ketogenic diet. The main thing is to have carb restriction, carbohydrate restriction. That's the medical term in the papers that are written about this. And you would pay attention to total carbs or net carbs, but total carbs is like the prescription strength, and net carbs is like over-the-counter strength. If net carbs isn't working, go to the prescription strength, which is total carbs. And what I'm finding is that a lot of people will start out doing this, but then people tell them that it's wrong or bad, and you have to count macros and worry about, well, remember that macro came from the epilepsy world, where you have to keep the ketones constant or the child will have a seizure. We're not talking about that, and actually you don't have to have fat to burn fat if you have fat on your body. So when you become a fat burner and you're losing body fat, I don't recommend that you eat or drink fats. I don't recommend that you put oils and butter in the coffee, willy-nilly without regard to how much. So that's a common mistake where I see a concern about drinking, and even drinking ketones is not necessary when you're on a keto diet, because the ketones come from your body fat. This is today known as lazy keto because I don't recommend that you do much monitoring. I mean, not many of my patients have time for that. What happens is your hunger goes away after a day or two. You lose 1 to 2 pounds per week without pills, products. I mean, it's lazy. If I like the term lazy if it means I'm lazy and smart about it. I don't have to work too much. I'm efficient. I don't like the term lazy if it means, I'm a lazy bum kind of thing, but the diet will work even if you're lazy about it. And some people call it dirty keto, which seems like a bad term, but most of my patients cannot have access and will not have the money to always buy top line, highest quality foods. And so I don't want to keep this idea away from people who can't afford eating that way. So the most important thing is keeping the carbs low without regard to the cleanest food that you can. Now, if you can eat that way, that's great, but you don't have to. So I made a few notes here that keto, if you're worried about food quality, the paleo primal, it's nice if you can, but it's not essential. And then I don't know yet, the research hasn't been done on whether adding ketones or adding oils is beneficial in the context of obesity treatment and diabetes treatment. Those studies haven't been done. I would love to participate in them, get them going, but I haven't seen them, so I can't recommend these other things. And intermittent fasting, total fasting, studies really haven't been done to show the safety and whether your body composition changes. Weight loss surgery clearly works, and the weight loss is so dramatic and so fast. There's a cost of weight loss surgery, and that's a loss of muscle mass. And so the concern in the low carb, high fat world is we want to make sure you're not losing muscle mass when you do long-term fasting. Now, intermittent fasting, meaning you're just eating once a day and you're not hungry, I recommend that all the time. I just don't call it intermittent fasting. Fasting, I've seen people use that as a tool in their mind to mean I'm only going to eat one meal a day, which is fine if you're not hungry. I don't like the idea that you're ignoring hunger signals. And my training tells me that you should have a little bit of something, of course, without carbohydrate as the day goes around. But so not enough information on whether intermittent total fasting or exogenous ketones, meaning drinking ketones, is going to be adding any benefit beyond the low carb, high fat diets that we've studied now for 20 years and I've used in clinical practice for about 14 years now. But we're waiting for that research. I'd love to be able to use new tools, this is where the confusion comes from, at least partly. I simplify things and try to keep it focused on real food just as much as possible, and I find that works pretty well at my clinic. Just a reminder again, the Adapt Keto events are a way to connect local leaders and local followers of the keto diet. The Adapt team will be in Long Beach on March 7th, and then in Winchester, Virginia, again, March 14, Atlanta, the Marietta area, March 21. You'll be able to check the websites because we have lots of great people from Long Beach. These are friends of mine, colleagues from the Obesity Medicine Association. So they're going to be giving different variations on a theme. It's not just, all keto. It's good information that hopefully will augment your total knowledge about how your body works and how to be healthy in today's world. Again, this is Dr. Eric Westman for Adapt Your Life. Until the next time.